very much, Manira, for joining us. She is the Chief Officer in NHS UK of Public Health Scotland. Thank you very much, Manira. Would you like to say a few words? How can Institute of Public Health become a sister to Public Health Scotland?
Okay, thank you, Dr. Saira, and your entire team for hosting me today. I've had a wonderful tour of the Institute of Public Health here in Lahore. Furthermore, I've managed to meet some wonderful colleagues in IPH that are doing some amazing work, really influencing the true preventative end of public health, taking into account some of the real different challenges and harms that are faced by communities across Punjab, but actually you're looking at it across Pakistan as well. So I think there's lots of similarities for us in Scotland that we can learn from Dr. Saira and her team, but also from the wider IPH. Furthermore, within Scotland, I think the standard about collaborating not just locally but nationally and internationally is really at the core of how we can amplify what our agencies are doing, but also support colleagues across the nations do the best for the communities we serve. I'm looking forward to strengthening our partnership. I've got lots that I'm going to take back to a lot of our colleagues back into Scotland, both Scottish and local government. And I think this is the start of a really fruitful, purposeful partnership. I look forward to learning, I look forward to sharing, but furthermore, I look forward to strengthening our relationships as well, Dr. Saira.
Thank you so much. We have a very large problem of referral here in Pakistan, especially in Punjab. And we want to know about your advice and suggestions. How can we establish a family medicine as a referral system so that the people can go to the right doctor, to the right place at the right time? So what are your suggestions for it?
Dr. Saira, great question. It's $1 million question, isn't it? We're all grappling with. So a few things that we've done in Scotland, which I know we're going to be sharing and following up on a bit later. So I think policy is really important. So having the right policy that supports a multidisciplinary team activity, and you talked about a bit of what the IPHs are doing around that. So in Scotland, we really do work towards a whole system way of working. So how can we use our data and our evidence? How do we make that translatable and digestible? And then how do we get that out to the multidisciplinary teams in our localities? We have our own Chief Medical Officer who has developed the realistic medicine with a number of colleagues in Scotland. And that report and that detail allows us to really understand the wider social determinants of health and well-being. But the importance is change happens in communities. They don't happen in our agencies. So how can our agencies be both supporting actors but also purposeful leaders when we need to be? So there's a lot we're going to follow up on that, aren't we, Dr. Saira?
Thank you so much. And my next question is about mother and child health. As you know, there are so many initiatives that are being done here in Institute of Public Health. We have a record of more than 20,000 households, and every household has an average of 7 to 8 people that are registered with Institute of Public Health. And it is more than 3 generations who are coming here for vaccination, immunization, and other trustable services that are being offered here. So how can we collaborate with the Public Health Scotland, and how can we strengthen our systems further, especially for mother and child health?
So mother and child health is equally important for us in Public Health Scotland as well. And we do have a whole host of fabulous people working within Scotland on this. And there's a few things that we've done. So it's not just the traditional things that we've talked about earlier, Dr. Saira, but also the fact that we're bringing in other agencies to work very closely with us. And one of the examples of that is the work we're doing with Education Scotland, for example. So understanding and supporting other bits of the system to really see public health in the widest sense. So working with head teachers and staff within schools as well to think about where the influence is coming from, how to support the whole family unit as well. So that's what some of the innovations, so going away from some of the traditional roots of where we think help is needed, but understanding where we can leverage some of the other professionals that are in this space as well.
Thank you so much. My last question is about the education. As you have mentioned about the Education Scotland, You know, we have a lot of students here. We have more than 270 students who are registered and enrolled in Institute of Public Health, Punjab. So how would you see the future of those students, and how the Education Scotland and the Public Health Scotland and Institute of Public Health can collaborate for future partnerships?
So that's a great question, and I think the more we can see the current and future generation as our allies and assets, the better there is. And I think there's lots of things that we can leverage from the World Health Organization, but I think, Dr. Saira, this conversation, this discussion even today has started to open up opportunities. How do we share from the knowledge that we've got in Scotland to those within the IPH in wider Pakistan, and vice versa as well? So I think some of that we'll have to work through what works best for us, but also how we can support each other in some of that education and learning. So Public Health Scotland, and in Scotland, education is very important. We ourselves have support education around research and development within our organisation, but in the wider system. So I think there's bits that we can share in our frameworks and processes that might help yourselves. But I'm sure, Dr. Saira, because of the cohorts that you're dealing with here, for some of the impoverished backgrounds, some of people coming from some of the most poverty areas